Hi, I'm Dr. Meredith Warner of Warner Orthopedics Wellness in Baton Rouge. So what we do is look at the whole person. So let's say you came in and you had shoulder pain. Well, sometimes because of these very long lines of fascia in the body that kind of spiral around, holding us all together, sometimes your left shoulder might really be a right hip problem because of the spiral line and the lumbosacral fascia. These are the things that we kind of take note of and look at. So we don't just examine the shoulder. We're observing the whole time. We'll check various different things. We'll look for trigger points in the muscle, and then we'll look at blood work. Sometimes I draw autoimmune panels, and I'll work closely with a rheumatologist if somebody has a rheumatologist. But if you don't have your own rheumatologist, your own endocrine doctor, your own diabetologist, we will at least start the preliminary workup and get some basic fundamental answers to why do you have this problem. A lot of people don't just have one problem. You might have a shoulder pain, you might have knee pain, you might have vision changes, you might have a rash, you might have GI issues, you might be depressed, there might be sleeping problems, and all of those things might just be a constellation of the same universe. And somebody needs to figure out what is the foundational fundamental problem that is causing all of this. So in other words, if you had shoulder pain and all that other stuff we just talked about, and somebody just went in and fixed your shoulder, really all they've done is made you different, but maybe not better. And so I try to make you better and not just different, if that makes any sense. We do operate, I do love doing surgery, and we will go that far if necessary, but my primary goal is to fix the underlying fundamental, be it metabolic dysfunction, autoimmune dysfunction, whatever it is, and then worry about the basic mechanical issues. And in those cases, I bring in my physical therapy team, which is awesome, and we will do everything from cupping to dry needling to a very detailed exercise program, from strength training to flexibility, whatever is needed to get you better. And all of this put together really does work. So if you treat a person like an actual person, I have found the orthopedic care improves.